Andy Burnham's delivered another big speech on reform today, this time pledging plans to reform social care in England. Social care in England is in a severe systemic crisis. It's driven by underfunding, staff shortages and rocketing demand. Unlike the NHS, which is free at the point of use, social care is usually means tested and delivered through a complex mix of local authorities, private providers and voluntary organisations. In his speech today, the Prime Minister insisted the issues plaguing the sector could not be solved without a cross-party consensus.
We're all going to have to give and take here, aren't we, if we're going to get to a solution? We're all going to have to listen to each other, something we don't do particularly well in politics. Actually engage and listen to other perspectives. We're going to have to find common ground here. If this is to be a lasting solution, it requires common ground to be found, and then ultimately you would hope a new social consensus can emerge.
Well, let's speak to the former Health Secretary and Conservative peer, Baroness Coffey, who joins us this evening. Baroness, good evening.
Good evening.
Thanks so much for being with us. Where's the incentive for a cross-party deal, if you're the Conservatives, with Andy Burnham?
Well, this is an issue that has been going around for some time. Clearly, the coalition government actually commissioned the Deal Not report. That came up with something, but the appetite wasn't there to do exactly what had been recommended. Actually, Andy Burnham, when he'd been Health Secretary, had proposed a way forward, which actually then involved a tax on people when they died. Theresa May had a go in terms of increasing the amount of the threshold for support up to £100,000, but with something there. And that didn't work either, because I think a lot of people hadn't really started using social care and hadn't realised that the threshold for support to get state support was actually quite so low. So I think we're in a different phase now. Andy Burnham's prepared to invest political capital, but I think it's right, actually, the Conservatives are saying this shouldn't be done through more borrowing and more taxes. We've got to find a way that within the system, that between the health and social care, that can get this to work properly. And frankly, there's a fair amount of money which could be shared between the two ways of providing care. One, obviously, nursing and doctor care. The other one, providing the social care that doesn't require that level of medical expertise. So that's where I think there is an opportunity, but I think the devil will be in the detail and where the cash comes from.
I mean, do you think the appetite is there from Kemi Baden? When you look at the polls, I mean, the big change that's happened is that Labour is now outstripping or par and par with Reform in terms of percentages. And the Conservatives are sort of perhaps not being talked about enough, but they're really not far behind at all when it comes to that polling. In other words, Kemi Badenoch seems to be doing a pretty good job. Surely the main thing for her is that she continues to challenge Andy Burnham and set out the Conservative alternative rather than sign up for cross-party consensus. And I wonder whether the caveat of no increased borrowing and no increased taxes is her way of saying, I don't want to look callous, but I'm not interested in this, because it doesn't suit the Conservatives politically, does it?
Well, Kemi has, on a number of issues, offered to work cross-party, but she's been pretty clear. For example, like welfare, what can we do to reduce the bill? What can we do to tackle the issue of social care that doesn't include more financial impediments on people today? So I think there's an element there of looking for efficiency, that interworking with the NHS. So it's not trying to, she set out some pretty clear red lines, but I don't think that means she's walked away from the idea of doing something cross-party. And I know she couldn't make the meeting today, but Stuart Andrew was there as the Shadow Health Secretary. I mean, the Prime Minister has already said that some savings from the NHS should go into care. When I was, for a brief time, Health Secretary, preparing for that winter, we gave £500 million, which most of it came from NHS budgets, into trying to do what we could to make sure the NHS and social care were in the right place so that people could leave hospital in a timely way. You know, it's still an issue around the country. It's particularly prevalent at the moment in some of the larger rural counties of struggling to get people back into their homes. Yeah. I think just last month it's just under 300,000, as it's called, lost bed days.
Yeah.
Look, these people aren't bed blockers. They just want to go home, a lot of them. And that needs to be worked through.
And the estimated cost of having a social care system that's fit for purpose, free at the point of use, is £18 billion a year. Data from the Nuffield Trust, we were speaking to them earlier, if you eased all of that bed blocking nightmare and made that system a lot more efficient with discharging people from hospital, getting them back into, you'd only save £2.5 billion. So it's a drop in the ocean, really. It certainly isn't the cure-all, and I'm sure you'll appreciate that. I mean, is Kemi Badenoch basically setting out an impossible task there to say, do not increase taxes, do not increase borrowing? Surely that is an impossible task.
Well, her argument, I think, would be let's save money, either making parts of the NHS more productive or where we can find money.
You're never going to raise £18 billion. I mean, practically, you're never going to raise £18 billion by doing that, are you?
Somebody else has come up with the cost of that. I don't know the validity of that. I think what's fair to say, and for your listeners as well, to say the only issue is about people not getting out of hospital to get home, it's actually a very modest amount, as you've already pointed out. It's only accounts for older people leaving hospital is only about 15 to 20% of the number of delays. Actually, about £14 billion a year now is spent on children with a very high amount per head. Then when you get onto the £34 billion spent on adults, half is spent on pensioners and half on working age adults. And we've seen in particular the life expectancy of people with learning disabilities, say like Down syndrome, has expanded enormously thanks to medical advances, but still a lot of care there. So there are different things, I think, which we perhaps might need to look into locally on a community level, what it is about trying to help people to stay in their homes longer.
Yeah, agreed. Look, just sort of stepping aside from that, I wanted to ask you about the decision under Liz Truss to scrap the social care levy. It was brought in as a temporary measure and it was due to be made permanent, but it was scrapped by Liz Truss. We've just been talking to Gillian Keegan actually about it because she was care minister for Boris Johnson at the time that it was introduced. It's a 1.25% tax tied to national insurance contributions. That was designed to inject just under £5.5 billion into adult social care over 3 years. Why did you decide to scrap it? That was Boris Johnson having started to try and come up with a fix which was already in place.
Well, it was actually Rishi's proposal. He put forward to Boris a number of different things, and I expect he thought Boris wouldn't agree to it.
Why did Boris Johnson agree to it, do you think?
Because he was happy to have a number of different policies which required money at the time. Bear in mind, this was not long after COVID, and we'd barely got out of lockdown and just recovering. And I think there were a number of us who felt at the time this was a bit uncomfortable because it was a tax on jobs. And normally Conservatives would be looking to cut national insurance, not to increase it. So, and actually Rishi did then come back later when he was Prime Minister and did a significant reduction in national insurance, which I think was the right thing to do to help keep that job stimulus going.
Yeah, but that was also, in all honesty, meant to be a vote winner, wasn't it? He slashed national insurance to try and secure votes.
Well, he set out at the time that he thought more money should be in people's pockets. So in terms of whether you tax jobs to do this, you tax people, or you look for savings, you look for funding, the amount of money going into the NHS is now, I think, about 43% of the government's day-to-day spend. And no doubt there's a connection there that has to be made. And I think there is a lot more that could be done, which would actually reduce the amount of money needed in parts of the NHS in order to help the social care.
And sorry to interrupt you, but I guess it depends how ambitious you want to be. Do you believe social care should be free at the point of use?
Well, I'm not sure that it should be entirely. It's a case of what is it that's needed? Why is it needed at that particular moment? I think there are good examples. The Prime Minister particularly has the experience of his father with severe dementia. Well, that might be something which should have what's called NHS continuing care and should be paid for by the NHS because it might need that additional support. So I think there's an element of thinking through of how we've got to a stage where most councils have closed down their homes is there not something there that we can look at again to think about how that recovers, rather than everything being done through agencies? This isn't about freezing out the private sector entirely, but seeing how we got ourselves into this state. And in particular, what has significantly increased is the amount of support being given to children. I mean, that is a massive increase from where we were just 10 years ago.
Look, Baroness Coffey has launched this big conversation on care today. This is all about making a public conversation about the future of adult social care in England. And I just wonder, based on your experience, does that sound a bit gimmicky for you? Is the whole reason why Labour's asking for public backing, for public input, it's because it might be the only way that they get some of this reform by their MPs to say, it's what the public want?
Well, it may be. It may be that. And by the way,
which is going to mean welfare cuts probably as well, by the way, if we're talking about getting Labour MPs on side.
So I think it's often a good initiative. I wish this had happened a bit earlier, perhaps. But to talk to people who are either going through this, then going through that as people who are, informal carers, people who do care every day, they're not bringing in care from outside. There's a variety of things that I think getting that lived experience really matters, and what would make life easier for people. And it's not all just about money. Sometimes it is about better coordination. Sometimes it's about having relief. So there's a number of things, and there have been initiatives over the years, but I appreciate the magic bullet hasn't been there. The Prime Minister's been very clear for a very long time. He wants to see this almost identical to the NHS. I'm not convinced that we need to be at that point, but I understand why he wants to drive that. As I say, there's initiatives which could be undertaken now, which might help with some of the particularly acute issues, but some of that is also about releasing money from people who want to be at home, and for whatever reason, the bureaucracies are not allowing them to get home.
Look, Therese, really good to speak to you. Thank you for letting us dig into your experience on this. Former Health Secretary and Conservative peer Therese Coffey. Good to have you with us.